I am sure you have heard news like this. A mother donated her kidney to her son, or a son donated his liver to his father to save life of them. This is possible due to important medical technique called as transplantation. Today in this video we will understand the science behind this fascinating phenomenon called as transplantation and graft rejection. The first question comes is, what is transplantation? Transplantation is the transfer of cells, tissues or organs from one individual called as donor to another individual called as recipient to replace a damaged or non-functional organ. Let us understand some common examples of transplantation. The first one is kidney transplantation, where healthy kidney from a donor is transplanted into a patient with kidney failure. Second one is liver transplantation. Here, deceased liver of the recipient is replaced with healthy liver from donor. The third one is heart transplantation. Same way as that of liver and kidney, healthy heart from donor is transplanted into recipient. Fourth one is bone marrow transplantation. Here, healthy bone marrow cells from donor are given to the patient to produce new blood cells. And the fifth one is corneal transplantation, that is donor cornea. Here, the damaged or diseased cornea is replaced with a healthy cornea from donor. Now, let us understand types of transplantation or graft. Based on donor to recipient relationship, there are four main types of transplantation or graft. We will study one by one. The first one is autograft. In this, tissues transferred from one part of the body to another in the same individual. The best example is skin graft in burn patients. Second one is isograft, also called as sin graft. In this, transplant is between genetically identical individuals, mainly identical twins. Third one is allograft, which is also called as homograft. Here, transplant is between genetically different individuals of same species. That is, donor will also be human and recipient will also be a human. Mostly, kidney transplant is done, which is an allograft. Fourth one is xenograft, also called as heterograft. Here, transplant is between different species. The best example is pig donor and human recipient, where pig heart valve is successfully transplanted in human. So, these are the four types of graft. The important point for NEET is success rate of graft acceptance, which is very high in case of autograft, medium in case of isograft, then very low in allograft and xenograft. This information suggests that the genetic identity affects success rate of graft. So, let us discuss next point, which is responsible for graft acceptance or rejection. If donor and recipient are genetically similar, the graft acceptance will happen. And if they are genetically dissimilar, there will be graft rejection. Second is HLA or MHC matching. If they are matching in donor and recipient, graft acceptance. And if there is mismatch in HLA and MHC, there is graft rejection. The third point is use of immunosuppressive drugs. If it is used, there will be chances of graft acceptance. But if there is no or inadequate use of immunosuppressive drugs, there will be graft rejection. If recipient's immune system tolerates graft, graft survives and functions normally. But if recipient's immune system attacks graft, graft is damaged or destroyed. If there is mismatch in transplantation, there will be high chances of graft rejection. On the basis of time, there are three types of graft rejection. First one is hyperacute rejection, which occurs within minutes or hours. Second one is acute rejection, which occurs within days to weeks. And the third one is chronic rejection, which occurs after months of or years of transplantation. This is easy memory trick to memorize graft acceptance and rejection. To avoid graft rejection issue, we can take some preventions. The first one is tissue typing, in which we have to match donor and recipient's HLA antigen. The second one is cross matching, where firstly we detect antibodies against donor tissue before transplantation. Third one is use of immunosuppressive drugs, and fourth one is use of closely matched donors like siblings or relatives.